Good evening, dear viewers, and welcome to a new episode of Medical Talk, your weekly window into health awareness and modern medical advancements. In today's episode, we address a topic that plays a vital role in women's health at every stage of life: obstetric and gynecology. From pregnancy care, hormonal changes, reproductive health, and early detection of women's diseases, this field remains one of the most essential pillars of modern medicine. Women often face questions, concerns, and sometimes misconceptions about their health, and proper understanding is the first step to prevention and wellness. To guide us through this important topic, we are honored to welcome Dr. Mohamed Elhusseiny, physician, specialist, and OB/GYN. Together, we will explore key issues in women's health, common conditions, and the safest and most effective approaches to care. Stay tuned, you're watching Medical Talk. Welcome back. We're happy to have with us in the studio Dr. Mohamed Elhusseiny, physician, specialist in obstetric and gynecology. Dr. Mohamed, welcome to Medical Talk.
Thank you. How are you, Doctor?
Good. I'm so happy to see you again.
Yeah, me too.
And today's episode is very wide, okay? And there's so many information that we need to cover. But first, let's start with cervical cancer, because it's a hot topic. A lot of people talk about it. Can you explain to our viewers what cervical cancer is and why it remains significant global concern?
Yes, cervical cancer, it's a cancer type of cancer that affects the lower part of the uterus. We call it the neck of the womb. And it starts usually with a long-term infection of certain virus called the human papilloma virus. And the virus stay silent for maybe many years until it gives any symptoms. And it has a global concern because it affects young ladies in mid-30s and 40s. And unfortunately, some of these ladies, they diagnosed late because of lack of regular screening. But the good news is that it's one of the most preventable cancer worldwide, although it's ranked number 4 globally.
Oh, well, that's actually good news.
Yes.
Now, you mentioned the HPV virus. We hear so much about it being responsible for the most cervical cancer cases, because as I understand, cervical cancer cases is not only caused by HPV, it could be something else.
Yes, exactly.
But what exactly is HPV? Because so we try to describe it in more details for our viewers.
HPV is...
How does it lead to a cancer, basically?
Yes.
Yes.
First, HPV is human papilloma virus.
So it's a virus?
Yes.
Yes.
And there's over than 200 types. We categorize these types in 2 groups, high-risk group and low-risk group. The low-risk group is usually responsible for a kind of skin tags we call warts. And our concern about the high-risk group, like number 16, number 18, these 2 types alone, they responsible about 90 to 95% of the causes of cervical cancer. The virus attack the cells of the neck of the womb and start to do some changes. We call it precancerous lesions. And if it was not diagnosed and treated properly, it will turn on in few years to a cancer. So regular screening is the key word here.
Yeah, exactly. Now, in terms of transmission, how is HPV transmitted, and what factors increases a woman's risk of developing the persistent HPV infection or cervical cancer?
Primarily, HPV transmitted by skin-to-skin sexual contact, but it doesn't need sexual intercourse. Only intimate contact is enough to be transmitted.
Okay.
And as we discussed, the virus get inside the cells of the neck of the womb and they start to control it. The problem if it become persistent, because usually the virus, the body can clear it on in about 80% of the cases. but if it's still persistent, it will cause the changes. Here is the problem. And regarding the risk factor groups, the risk factor groups usually the immune compromised patient, like diabetic patient will be more vulnerable, of course, and smoker, alcoholic, early sexual activity, as well as some kinds of co-infection like chlamydial infection. So it's very important to treat any vaginal infection promotely and get away of these risk factors and try to keep healthy life system.
Absolutely. Now, one challenge we often hear about is that cervical cancer may not show symptoms, as you mentioned, early on. It's like a kind of silent disease.
Exactly.
But what signs, if any, should women pay attention to?
The problem in early stages of cervical cancer,
there are no symptoms.
Exactly. There is no symptom.
Yeah.
It's silent. And this is why exactly the screening is very important, because no one is protected.
But once we reach the signs stage, what would you say that like the number one alarming?
Yes, usually number one alarming in the form of unusual discharge, unusual bleeding, especially after intercourse, some pelvic pain, some discomfort. This is the alarming sign. So any women experiencing this symptom, they should go directly and check herself.
Yeah, and also to make sure that we rule out any urinary tract infections or any other diseases that actually could mimic.
It would be for general evaluation, but we put in mind now and that we need to ask about, in the gynecology history, about the smear history. Yeah. When you had your last smear, is it was normal or no? And unfortunately, I find many ladies, they are not aware at all about what is cervical smear.
I'm glad that you mentioned that, because this is actually my next question. Screening, I would say it's fair to say the screening has proven to be a lifesaver. Can you walk us through the pap smear and the HPV test, how they are performed, explain to our viewers when the woman should start basically the screening process?
We have two components for the screening. The first component is pap smear, the SIN prep. And this looks for the abnormal changes or abnormal cells in the neck of the woman. The second component is HPV virus itself, the virus that causes the changes. And both of them are very simple. Test can be done in few minutes as outpatient procedure. And regarding the time when we start, it's different as per the national guidelines, but usually we start at the age of 21. And if the patient is not married, after marriage, sooner after marriage. And it's efficient until the age of 65 years old.
Yeah. So usually, do you usually do it like on an annual basis?
It depends on the national guidelines. The American have the guidelines, the British have the guidelines, but usually we repeat the smear, which looks for the abnormal cells every 3 years, and we look for the virus every 5 years.
Okay. All right. So I want to ask you about how you said 21 years old. This is as the early. Is it possible that women can experience HPV in a younger age?
Yes, because of this.
Like 16, for example?
There's a very important prerequisites for the lady to be sexually active.
Yeah.
So if she got married before 16 years old, yes.
Because there are some cultures who are open and acceptable for getting married younger or older.
Exactly. So the vaccination started in UK from 11 years old.
I'm glad that you mentioned the vaccination. I have so many questions for it, but we have to take a short break. There is a report. We're going to watch it and be right back. Stay with us. Welcome back. We're still talking in the studio to Dr. Mohamed Elhusseiny. Dr. Mohamed, before the break, you mentioned the magic word, which is the vaccine. And God knows, after Corona, a lot of people a little bit hesitant about vaccines. And now we know there is an HPV vaccine or vaccinations. And we know that it has transformed prevention worldwide. What should our audience know about vaccines types, recommended ages, and their effectiveness?
HPV vaccine is long time ago they are using it in UK, even in Saudi Arabia, and recently in Kuwait they start to implement national guidelines for the vaccination, and it's available in the MOH, and the vaccine is totally safe. The vaccine protect the women from the high risk types of HPV that most of them will, about 90% of them, they will cause cervical cancer. So it's very important. And we can start it by the age of 11 years old, and till the age of 26 it's effective. And in some countries they consider it, after discussion with doctors, till the age of 45 years old. If we start the HPV vaccination at the age of 11, 2 doses will be enough. But by the age of 25 or after 25 years old, she will need to take 3 doses. And it will give a long life immunity from the dangerous type of HPV. But we need to highlight that HPV vaccination, it will not be exemption from the screening program, because still there is some other types can cause cervical cancer.
Exactly. It's not just the human papillomavirus, as you mentioned earlier. It could be other things. Now, for a woman diagnosed with precancerous changes or cervical cancer, what are the current treatments, approaches, depending on the stage?
It will depend. If it's precancerous lesion, usually we can manage it in outpatient clinic by a simple procedure, one of them called large loop excision of transformation zone. This is a transformation zone in the neck of the womb that every changes start from this point. Or cone biopsy, another procedure, simple one. But if we reach to the cancerous lesion, in the early stages it can be managed by surgery, and some of them fertility preserving, we can preserve the womb. But in advanced cases, it will be a combination between chemo and radiotherapy.
Is it possible that a woman can have cervical cancer during pregnancy?
Yes, it's during pregnancy.
Or be discovered during pregnancy? Because I tell you why, because many women worry about HPV during pregnancy. Is that even a possibility?
We are talking about the screening. The screening during pregnancy is safe, nothing about it. And even if the women caught HPV during pregnancy, HPV itself, it will not affect the pregnancy or the baby. And we monitor and screen for HPV and for cervical screening during pregnancy safely. But we postpone any surgical intervention if needed until after delivery
of the baby, exactly. But it's basically, there's no any imminent danger to the baby or the woman.
There's no imminent danger for the baby or the woman. We can do the screen safely, and we watch any cervical changes closely during pregnancy, no problems.
Exactly. Now, beyond vaccinations and screening, what lifestyles or behavioral measures can a future or further basically reduce the risk of future cervical cancer?
Apart from screening and vaccination, protecting the immune system is very important, because the virus attack the host immunity. As we mentioned, about 80% of the women get infected with HPV. The body will clear it by its own. So the immunity is very important. So smoking, stop smoking, treat any infection remotely, and keeping healthy lifestyle. all these steps will decrease the likelihood of having persistence of HPV infection.
Exactly. This is my favorite part of the program, where we unveil or talk about myths and misconceptions. There are still many misconceptions about HPV and cervical cancers. Could you clarify some of the most common myths and misconceptions encountered in your practice?
Yes, there's many misconceptions. Let's start with get infected with HPV mean there's someone unfaithful at home.
Oh, yeah. Yeah, it has to be, you know.
Yeah, this is truly, it's not true at all, because the virus can stay silent for many years. So it doesn't mean there's someone is unfaithful at home. And the vaccination can cause infertility.
Yeah.
There's no evidence at all or any studies that claim that the vaccination can affect the fertility, but the vaccination is totally safe. And apart from this, I'm fine. I don't have any problems. I don't need to be checked.
Denial.
Yeah,
basically.
But as we said, the early stages are always silent.
Yeah.
So screening is very important as well.
And you mentioned also earlier, there are campaigns in Kuwait right now.
Yes.
Even in the Ministry of Health and also the private sector. There are so many programs that a woman can approach for screening and education.
Yes, of course. We started screening and increase the awareness about cervical cancer in Kuwait about 5 years, 6 years ago. And the ministry started to supply a regular vaccination program for anyone seek the vaccination. And it was available before in the private sector only, but now the vaccination is available in the ministry. And as well as we said the screening can be offered for anyone. And immediately after marriage, it will be very convenient to start your first pap smear, because the key...
After marriage, yes.
Because of our culture,
yeah,
you know?
Absolutely, yeah.
Because of our culture.
But that's the recommendation that I'm saying.
Yes.
Yes.
Yes, after marriage was 6 months, 3 months, you should start screening program immediately, because it will protect you and protect your health. Because the key word, as we said, early detection will prevent precancerous, and will, even if there is precancerous lesion, it's manageable. And after that, it will be a little bit too late.
Dr. Mohamed Elhusseiny, an OB/GYN specialist, thank you so much for all the valuable information that you shared with us.
Thank you.
And hopefully the message will be received by our audience. Get your vaccine for the HPV, and also the screening earlier to prevent any problems with cervical cancers. Thank you so much, and hopefully we'll be able to host you again in Medical Talk.
Thank you, Dr. Mohamed. I'm always happy to stay with you here.
Thank you. Thank you so much. Thank you. Dear viewers, we still have more. Stay with us. We'll be right back. As we conclude today's episode, we remind our viewers that women's health is not only about treatment. It's about awareness, prevention, and early care. With the right guidance and regular checkups, every woman can take confident steps toward a healthier and brighter future. Thank you for watching Medical Talk. Until we see you again, please stay safe and stay healthy.